protocol. But guess what happens when you throw at them that you want to start your child on vitamin C? You want to do all these different therapies, and you're working with this awesome chick named Season who's helping your child feel amazing through treatment, but she's suggesting you do this, this, and this. And you start throwing this at your oncologist, they are going to stop you dead in your tracks and say, no, you cannot do that. And here's why they're saying it. Because they all of a sudden lose control of what they know to be step 1, step 2, step 3, step 4, no evidence of disease. Now you're throwing things in there they know nothing about, and they feel like they lose control over the process and over the protocol of the conventional approach to cancer. And so they want to see your child have no evidence of disease at the end of this, just like you do. But the minute you start throwing all these other things that you're doing, they don't know how to, they put their hands up because they don't know how that interacts. They don't study it. You guys, oncologists get a 7-hour elective in nutrition. They go to school for between 6 and 8 years. And in 6 and 8 years, they have 7 hours of nutrition.